Viewing or listening to this podcast confirms acceptance of the disclaimer visible on your screen or found at authorscott.com/podcast. Welcome to the Regaining Health and Humanity podcast. I'm Dr. Scott Johnson, your guide on this journey to natural well-being. Here we explore evidence-based insights, revolutionary breakthroughs, and powerful health strategies that not only inform, but inspire change. Together, we'll uncover the mysteries of human existence and unlock the secrets to thriving. This podcast is more than just knowledge. It's your catalyst for unleashing extraordinary potential. Get ready. Your journey to boundless health and happiness starts now. Hello, friends, and welcome to the Regaining Health and Humanity podcast. I'm your host, Dr. Scott Johnson, and I am so glad you are listening or watching today. As parents, we want to provide the best care for our children, and there are many natural solutions to use when it comes to their care. Each of these solutions represents a tool in our toolbox, and today we are going to discuss homeopathic remedies. To discuss this, I've invited Dr. Palak and Dr. Kinjal Shah, homeopathic doctors from India, to the show. Dr. Kinjal Shah is an experienced homeopathic consultant practicing for 14 years. She is certified in Silva mind control and stress management and a certified yoga trainer. She specializes in mind-body connections, stress management, and the homeopathic management of conditions such as chronic pain, allergies, hormonal problems, ADHD, and digestive disorders. Dr. Palak Shah has 12 years of clinical experience as a homeopathic doctor treating various acute and chronic conditions. She specializes in pediatrics with a special interest in childhood skin disorders, recurrent respiratory infections, autism, anxiety, and behavioral problems. She does seminars on parenting and childhood development. Welcome to both of you.
Yeah.
Well, I appreciate you taking time out of your day to discuss this because I think homeopathic remedies maybe are confusing and they're difficult for parents to maybe incorporate because there seems to be at least a steeper learning curve to using them. And so I'm glad that we're discussing this topic and can maybe give some parents a little bit of guidance to help know how to incorporate homeopathics into their toolbox and use that for their children. Dr. Palak, can you begin by explaining the principles and concepts of homeopathy and how it works to restore health?
So homeopathy means, as the name suggests, homeo is similar, pathos means suffering. So homeopathy is based on a certain cardinal principles. One of them is like cure likes, which is similia similibus currentur. What it means is that if any natural substance has an ability to produce a certain sign and symptoms in a healthy individual, then if that substance given in a remedy form has an ability to cure same set of signs and symptoms in a diseased person. Okay. So to simplify that, so if I say, like, if you're cutting an onion and then your eye starts watering, homeopathy remedy prepared from an onion is also used for something similar like watering of eyes. So it's a very good remedy for conjunctivitis, rhinitis, and allergic constipation. So similarly, like a rustox, which is a plant-based medicine, which has an ability to produce, as is rustox poisoning, like a vesicular eruption. If you come in contact with, it'll give you like a fluid-filled eruptions. Then, if given in a remedy form, it actually cures vesicular eruptions, which happens during fever. And in children, we see a lot of viral infections have vesicular eruptions along with the fever. So rustox is a very good remedy for that. So it's actually what you see in nature, and then you learn by drug proving and then you use it as a symptom similarity for a prescription. So homeopathy is based on a symptom similarity and individualization of our patient.
Yeah, that makes total sense. And I remember studying that as part of my doctorate in naturopathy. I took some extra courses on homeopathy because I wanted to learn additional information about it and really dial that in because I think it's such a unique concept or natural solution. Dr. Kinjal, I have a question for you because homeopathy may be confusing to the average parent because of all the dilution indicators like 30X or 30C. Can you simply explain these dilution percentages and also how to choose the appropriate potency?
Well, it is very simple. Potency is something which indicates the diluted substance in the medicine. Okay. So when you say 30C, it is diluted 3000 times into 100. Okay. So the original substance is being diluted 3000 times, that is 30C. Now, coming to normal people, normal parents, how to choose the potency, it depends on the symptom severity. How severe is the symptom? Based on that, we choose the potency. For patient, I would say you start with 200. If 200 is giving 80% relief but not curing it, you can jump to 1M. In very few cases, we start at 30. So that I would suggest you be under a homeopathic doctor and get it cured rather than self-medicating. Because some potencies can have extra symptoms. I'm sure it will go off with the time. It's not side effects, but it is better to be under expert to select right potency. But yes, when you want to start, begin with 200 because that's the safest. And also, some of the medicines you should dilute and give it to your child. That is very important. So first, take like half a bowl or like 100 to 200 ml of water and put your 4 pills into it, dilute it in water, and then take it.
Thank you. Dr. Palak, which homeopathic remedies are most effective for treating colds, flu, and sore throats in children? Because these are just common things that your kids are going to experience at some time usually. And so parents want to know how to use these type of remedies for these conditions.
Sure. So if your child is suffering from cold, then there is a medicine called Calimure, Natromure, Ferrofos. They are all first line of treatment. They're all anti-inflammatory. If you want to start with a 30C or even a 6X potency, that would be also nice because in a 6X potency, they are more like a biochemic salts. So when you are giving in a biochemic salt form, you could also use them like a preventive treatment. But when you give it in a potency form, which is a C potency form, then you could give them like a less dosage. So we say maybe twice in a day for 3 to 4 days, and then the cold will subside. The if you have something like allergies or if the cold is based on a weather change, so we have to evaluate the symptoms based on what is the causative modality and what are the symptoms like. If the symptoms are like if there is a runny nose which is watery, or if it's a thick one, or how does the flame look like, or is there any eye symptom associated, any throat pain, or if there is just dry cough or a wet cough. So when we do the analysis of any particular ailment, we do it in a quite depth. So then we come to a particular remedy which should help in all the symptoms of that particular episode. For parents in general, Ferrofos, Calimure, Natromure, Allium cepa, Euphrasia, arsenic album, they are very good remedy to give your children.
Yeah, those are all common ones that I know are very readily available here in the United States. And so it would be something that parents could just have like a stockpile of these particular remedies and have them available and ready so that when they deal with these situations, they're already prepared. Dr. Kinjal, when dealing with eczema in children, what are some common homeopathic remedies parents can try, and how do they differ based on the severity or type of eczema?
Eczema can have different presentations. So first I'll tell you the remedies which are commonly used, like Kilkiria cough, sulfur, miserium, graphites. These are the commonly used medicines. Hiparsulf, then Restox, based on if the eczema has been triggered by weather change and it has an itching and inflammation, then you can think of Restox. If there is a lot of burning, itching, and a lot of unhygiene in the area, then you can think of sulfur. If the eczema is like a cracked one and the very dry one, then you can think of petroleum as one of the remedy. So basically, graphites is also one in which there is a lot of oozing, like there is a lot of serum coming off the eczema. So miserium and graphites are the two used for that. So based on the look and the local symptoms in the eczema, you can pick up those remedies and help your kids. It will be very helpful. They will not suffer much. Immediately, there'll be a relief to them.
Dr. Palak, for a child experiencing recurring tonsillitis, what are some key homeopathic treatments, and can they reduce the frequency of infections over time? I'm particularly interested in what you would do for a child with chronically enlarged tonsils that doesn't necessarily prevent with the typical recurrent infections.
When it comes to treating an ailment, it has to bother the child enough, for us to, therefore there need to be able to treat. If there is a chronic enlarged lymph, tonsils, but then they are not causing any pain, no fever, no swallowing difficulty, no snoring problem, then I think it's better that they're left alone, because you have to understand that the tonsils are also our first line of defense, like for a child. So if there is any infection going, they are basically part of our immune system. So it's preventing and it's kind of triggering that first immune response to fight back against the foreign stimuli. So if they're not causing any pain, we leave them like that. In case of a homeopathic medicine, for just like a painless enlarged lymph nodes, biochemic salts would be good. You could continue with the heparins of 6x for a longer period of time, which will reduce them in size. And if they are symptomatic, so be it like acute tonsillitis, chronic tonsillitis, or recurring tonsillitis, then based on what kind of symptoms they have, like suppose there is like a poking pain in your throat while swallowing, the pain going to the ears, there are crypts, there is this pus follicle, then the heparsulf is a very good remedy. In acute, I understand 30C is a very, very popular potency used worldwide. But we are Indian doctors, we are used to even 201M, which is
we use 1M quite frequently.
So the whole idea of around potency is so there's a lot of difference of opinions, because of there is no substance which is seen in higher potency, the substance is seen less in higher potencies, but for a practitioner, higher potency in acute condition works much faster. So in our private practice, we've seen it is working faster than antibiotics. Now, so if we have to avoid antibiotics, or any anti-inflammatory medicine for a tonsillitis pain, then we rather prefer a higher antibiotic. So then the child is put to the relief faster. So Heparin sulf is one very good remedy. Belladonna is very good remedy. When you examine the mouth and you see the red congested tonsil, then the belladonna works very good with the fever, high fever. Even the good part with that, even the fever comes down faster, So we sometimes even don't have to give them a paracetamol or any fever reducing substance. The Heparin, belladonna, then we have a Merck salt, which is like a chronic tonsillitis, recurring chronic tonsillitis, or a very, very bad staphylococcus infection. So like a glandular infection along with the tonsil, and very the pain going all the way to the back of the throat. Examine the child, see the ailment, what was caused it, be it bacterial, viral, food, and prescription kidney weight.
Yeah, that makes total sense. Another common thing are earaches. So, Dr. Kinjal, how does homeopathy address earaches in children, especially for those who are prone again to recurrent ear infections?
When it comes to earaches, parents are little, me being parent, I can also understand. It is generally like 80% of the cases will have night aggravation. And that is the time you don't have doc available. So I would suggest keep these medicines at home. Commonest one used is pulsatilla 30. Left-sided ear pain, pulsatilla 30, you repeat it every 2 hourly, it will 100% go. You don't have to worry. Belladonna, chamomilla, heparin sulf, moxol. These are the commonest. If there is a pus formation, if you feel it is infected, go for heparin sulf, moxol straight away. If you feel okay, it's just the earache and because of the water going in, or because after the hair bathing or after swimming, think of belladonna, think of heparin sulf. Or if there is severe pain and there is no other indication that you know, think of chamomilla and senna. This will help. Earaches, we have seen wonderful results with homeopathy.
Right, and I agree. Having those remedies available, it is a nighttime thing, and so the child is usually going to experience that when a doctor is not available, unless you're going to take them to an emergency room, which is not ideal. So, yeah, keeping them around and having them ready and being prepared is so important. Dr. Palak, can you share some homeopathic approaches to managing coughs and respiratory issues in children, especially for conditions like bronchitis and asthma?
So asthma, like if it's like intrinsic or extrinsic, like if it's a something which is because of the hereditary origin, or if it's something which is environmental, food, emotional, or if it's like any external stimuli causing it, like a pollen or anything. So based on what is the causative modality, and also how the child is generally feeling while having an asthmatic attack or while having that bronchitis attack, we prescribe the medicine. We see also if the child is like thirsty with it, with aggravating, if it's like a morning aggravation, evening aggravation, or night aggravation. Also the bedtime, like if it's getting worse when lying down. So what aggravates, what gives them a relief, that we really take into consideration. So when actually you are going to any practitioner, giving these his symptoms, like giving the detailed information of your child, would really help the practitioner to reach the remedy, like a similar for your child. So for the parents out there, be observant of what your child's particular episode looks like, and what makes them better, what makes them what gives them aggravation, all that please note down. Coming back to the remedies, the few very good remedies are like, suppose if there is let's talk about a weather change. Cephalalinum is a good remedy for summer aggravation. Medorinum is a good remedy for like a humid weather, like a monsoon aggravation. Nectrum sulf is a very good remedy for damp weather. Like, you suppose living in a cellar, like a room where there is humidity, like, you're living in a basement and it gets worse the moment you step in your basement, and then it gets worse. That means the natural sulfur is the remedy for you. Then there is a very good remedy called antimunitat, which is like the asthma is so exhausting that the child is not even able to sit. You're always drowsy, so your basically oxygenation is not correct. So in that case, antimunitat works very well. Carbo veg is very good remedy, and again, for a chronic cough, which could be a dry, then spongia is a very good remedy. And for a cough with a lot of mucus, expectoration, like in case of a bronchitis, then again the heparin works. Even like if your child is not able to bring out the mucus, then the antimunitat works. So but in general, when you give remedies like antimunitat, heparin, metronidazole, Tuja, they give you a very good relief from asthma.
Dr. Kinjal, gastroenteritis, commonly known as stomach flu, is an illness caused by infection of the gastrointestinal tract. It's often a foodborne illness from something the child ate or drank, and children with a compromised immune system are particularly susceptible. What is the homeopathic approach to stomach flu in children?
There are two ways. Basically, when you know your child is susceptible frequently, like you're getting this episodes frequently, then I would suggest you go for homeopathic constitutional treatment, which increases the immunity of your child, and the child is not susceptible to it every time. But when we see a patient in acute, like a child is coming with a flu and coming with a food poisoning, or then definitely it's the symptomatic treatment. Generally, the medicines that is helped is key one is arsenicum album, then also cinchona, then podo, phylum. These are the medicines that helps. But if you ask me, generally constitutional helps much better than this, because after the episode goes off, they should be put on their constitutional medicines to increase the immunity, because stomach flu is a kind of illness which leaves, even if 10% of it is remained in the body, then can recur again. It can have, I would say, greater impact over the child's immunity and growth in future. So it's a suggestion that even after acute episode is over completely, you start their constitutional treatment and complete it.
Yeah, that makes total sense. You're kind of going to a deeper level with that constitutional remedy and giving the child an additional level or layer of support. Last question, and I'll kind of just open this up to either of you to answer, is can homeopathy be used preventatively to strengthen children's immune systems and reduce the likelihood of catching colds, flus, or other illnesses? And if so, what are your favorite remedies for this?
Calcaria phosphoric, tarantula, tuberculinum.
Yeah. For building immunity, I would say also there's another good, very line of treatment is biochemic salts. They could work very well, like you give in association with the constitutional remedy. Why constitutional remedy is important is because, as we discussed, the first thing, like if you are if you are giving a substance in a potentized form, it is stimulating your own vital force, which is the energy level of our body, to heal itself naturally. So when we are giving a constitutional remedy, it works like a preventive medicine. So you're healing your natural vital force, which is innate to your body, on a regular day, on a regular basis. So So, your child will fall sick less often. When they are put, when it's, everyone, like, goes to school, crèche, daycare. So, the other kids there also have some kind of a bug. Your child is always constantly exposed to a lot of, either viral bacterial infection. So, when we are giving a constitutional remedy or we are giving a biochemic salt, which is almost like a supplement, to your child's system. They work very well as a preventive care, um, for building up their immunity. And when we give naturally, like to our patient in our practice, we also say ask them to consume like a concoction of like natural substance like um, like uh, turmeric, mint leaves, ginger, um, so honey, lemon, those things also naturally builds their immunity. So it's not about or homeopathy or a natural remedy or anything. You take, you give, which is very easily available and which is also it's not harmful to your child. Which is your basic home remedies like biochemic salts are easily available. These natural herbs are easily available. So that could be also given on a regular basis to remain all these, upper respiratory problems.
Yeah, they'll pair well with, of course, lifestyle is important. What you eat, your movement, stress, sleep, all these things that are foundational, and combining the herbs with them, that is definitely something to consider. Thank you both for being on. Those parents that are listening, I know in the United States there are actually homeopathic kits you can buy with various different remedies, so you have them always available for you. So that's a good idea. And then always have a good resource. Maybe find a homeopathic consultant or doctor in your area that would be able to guide you in those times where you don't feel comfortable in finding the right remedy. But it is simpler than it seems if you have just a little bit of guidance and knowledge and the basic understanding of how homeopathy works. So thank you again so much for being on.
Thank you so much for having us.
Bye. Good day.
Thank you for sharing your time with us today. I hope you've gained insights to elevate your health and life. For more transformative evidence-based wisdom, I invite you to explore my 20-plus books at authorscott.com/shop. Don't miss out on the chance to supercharge your health and guide others to a better life. Like, share, and subscribe to join the movement transforming lives. Here's to your journey toward boundless health and happiness.